Hi, my name is Molly Wagman. I am a certified diabetes care and education specialist, and I'm the lead diabetes care specialist with 9amHealth. At 9amHealth, we offer doctor visits, medications, lab tests, and comprehensive diabetes education and support with unlimited chat and visits with our diabetes care specialists, all remotely from the comfort of your home. So what is type 2 diabetes? In simple terms, type 2 diabetes is when blood sugar, our body's main fuel source, is consistently elevated due to insulin resistance. So genetics, which is the things that you were born with, plus environmental factors like exposure to pollution or viruses, and lifestyle factors like the food you eat and the exercise you do, all contribute to developing type 2 diabetes. There's two terms that we really need to understand when we're talking about diabetes. The first is blood sugar, which I've mentioned a few times. So this is literally the sugar in blood. So sugar comes from the food we eat. We also store some sugar in our liver and in our muscles, and it fuels us throughout the day. Our brain needs glucose to function. Our lungs need glucose for us to breathe, as well as physical activity that we do. And insulin is another term. This is a hormone that allows our cells to use glucose. So without insulin, the glucose just stays in the blood. We need insulin to allow it to be used. It's like a key that unlocks the door into the cells, that allows the glucose into the cells. Type 2 diabetes is caused by insulin resistance. This happens due to a variety of factors, and I'll get into all of those factors when you all request a science lesson, but today we'll just keep it simple. So the signs of insulin resistance and type 2 diabetes sometimes can be hard to spot. There typically aren't any strong symptoms that you feel, in the beginning at least. And the only way to know is by doing a blood test called an A1C check. And an A1C checks the average glucose over the past 3 months. And you can also do blood checks at home to help determine if you have diabetes or prediabetes with a glucometer. Now, over time, when the blood sugar slowly starts to rise, and over many years, if it's not treated, glucose continues to rise. Diabetes is a progressive condition. You can feel tired. Sometimes you start to feel really thirsty and you're drinking more, which then means you're peeing a lot more, maybe going to the bathroom several times overnight. Maybe you're feeling a lot hungrier, and whenever you eat, you just never feel satisfied. So these can all be symptoms of diabetes later down the line. And we care about managing diabetes and catching it as early as possible because there are some long-term complications from diabetes that can happen. So the blood goes everywhere in our body. So if the blood glucose is consistently elevated over many years, we can start to experience numbness or tingling in the legs, in the feet, in the hands. You can experience blurry vision, even sexual dysfunction in both biologically male and female. It can lead to stroke and puts you at higher risk for heart attack. So it's really important to get diabetes diagnosed as early as you can and get on top of the management right away. Now, there are two main types of diabetes. So we've been talking a little bit about type 2 diabetes, but I just want to make sure that we clarify the differences between the two main types of diabetes that you most often hear about. So both have genetic components. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune disease, and this means that the body is attacking the cells that produce insulin. So then the body no longer produces insulin, or it produces a really, really small amount. And people with type 1 diabetes then have to take insulin, whether that's through multiple daily injections or through an insulin pump. And people with type 2 diabetes, again, there's still a genetic component, but it's not an autoimmune disease. It is caused by insulin resistance, and there's many different factors that come into play that contribute to that insulin resistance. Most Americans are at risk for developing type 2 diabetes. So some things that can contribute to the development of type 2 diabetes. One, there's a really strong genetic component. So if you have a family member, a brother or sister, or a parent or a grandparent, anyone close in your family has diabetes, then you're at higher risk automatically for having diabetes. Carrying excess weight around your middle also puts you at risk for developing type 2 diabetes. And then some lifestyle factors like smoking, the foods that you eat, an inactive lifestyle, sleep, lack of sleep, or high stress, all of this can contribute to developing type 2 diabetes. But again, it's not these lifestyle factors alone. There is a genetic component. Type 2 diabetes is managed in a few different ways. One, it's heavily lifestyle based. So healthy nutrition, exercise, sleep, stress management, mental health, all of this is important for the daily management of diabetes. You can also take medication. People with diabetes often start with metformin, but there are many other medications that people can take to manage their diabetes. And this is a lifelong commitment. So diabetes is a potentially progressive condition, but it is a chronic condition. This means that it's something that there's no breaks from, there's no vacation from, but there are ways for you to manage it that become just habits for you. It's not always easy to stick with in the long run where you're gonna do exactly what you want every single day, but just know that there's going to be ups and downs in your feeling of your commitment and your feelings of success with your diabetes management. At 9amHealth, we can help you manage your diabetes in the best way for you. So we really specialize in individualized care for people with diabetes. We have doctors to write prescriptions and manage your medications and your labs, and these are all delivered to your home. So you don't have to think about it and you never miss a dose because you ran out or you couldn't afford it. And we have diabetes care specialists here to help you interpret your blood glucose values and other lab values, help you with ideas and support for your lifestyle habits. Again, like healthy nutrition, maybe you're starting an exercise routine or you want to get better quality sleep or sleep more. And we can just be someone here to talk to. We're here to support you. We believe that you are a person first and you're someone who's living with diabetes, and we're here to help support you in whatever way that you want to manage your diabetes best. So check out our website at 9am.health and visit us on social media. We'll be creating a lot more content like this in the future, so make sure to like, comment, and subscribe to our channel for more diabetes education and support from 9am. Thank you.